Human Metapneumovirus, or HMPV, is a common respiratory virus. It belongs to the same family of viruses as the respiratory syncytial virus, RSV, and is known to cause respiratory infections in people of all ages. Despite its prevalence, many people are not familiar with HMPV, which can lead to confusion when symptoms arise. It's, well, quite similar to the flu, or RSV. These viruses share many characteristics, including how they spread and the symptoms they cause. HMPV, like the flu and RSV, is primarily transmitted through respiratory droplets when an infected person coughs or sneezes. It can also spread by touching surfaces contaminated with the virus and then touching the face. HMPV was first discovered back in 2001. Researchers identified the virus while investigating respiratory infections in children. Since its discovery, HMPV has been recognized as a significant cause of respiratory illness worldwide. Studies have shown that it is a leading cause of bronchiolitis and pneumonia in young children. It infects people of all ages, especially young children and older adults. These groups are more susceptible to severe illness due to their developing or weakened immune systems. In children, HMPV can cause symptoms ranging from mild cold-like symptoms to severe respiratory distress, requiring hospitalization. The symptoms of HMPV are pretty much like other respiratory infections. They can vary in severity and may include a range of respiratory and systemic symptoms. Early symptoms often resemble those of a common cold, making it difficult to distinguish HMPV from other respiratory viruses without specific testing. These can include a runny nose, cough, fever, and sore throat. Other symptoms may include wheezing, difficulty breathing, and a decrease in appetite. In some cases, individuals may experience muscle aches, fatigue, and irritability, particularly in young children. In most cases, HMPV causes mild cold-like symptoms. Most people recover without needing medical intervention. However, it is important to monitor symptoms, especially in young children and older adults, to ensure they do not progress to more severe conditions. However, HMPV can be more serious for some people. Those with underlying health conditions such as asthma or chronic obstructive pulmonary disease, COPD, may experience exacerbated symptoms. Additionally, individuals with compromised immune systems are at higher risk for severe illness. This includes young children, older adults, and those with weakened immune systems. For these individuals, HMPV can lead to complications such as bronchiolitis, pneumonia, and even respiratory failure. Hospitalization may be required to provide supportive care and manage symptoms. In these cases, HMPV can lead to more severe respiratory illnesses. Intensive care and mechanical ventilation may be necessary for those with severe respiratory distress. Early detection and treatment are crucial to improving outcomes for high-risk patients. It's important to remember that HMPV is a common virus. Awareness and understanding of the virus can help in early recognition and management of symptoms. Preventative measures such as good hand hygiene and avoiding close contact with infected individuals can reduce the spread of HMPV. Most people recover fully with rest and fluids. Staying hydrated and getting plenty of rest are key to recovery. Over-the-counter medications can help alleviate symptoms, but it is always best to consult with a healthcare provider for proper guidance. With proper care, most individuals will recover from HMPV without any long-term effects. Recently, there has been a significant surge in human metapneumovirus, HMPV, cases in China, causing widespread concern among health officials and the general public. This virus, which primarily affects the respiratory system, has seen a sharp increase in reported cases over the past few weeks. This alarming rise in HMPV cases has led to a substantial increase in hospital admissions, particularly among young children who are more vulnerable to severe respiratory illnesses. Pediatric wards across the country are experiencing unprecedented levels of occupancy. The Chinese healthcare system is actively monitoring and responding to this surge. Healthcare workers are on high alert, continuously monitoring patients and ensuring that they receive the necessary care. Medical staff are working around the clock, reviewing patient charts and discussing treatment plans to manage the influx of cases. Hospitals are seeing a higher number of patients with respiratory illnesses, leading to crowded waiting rooms and emergency departments. The increased patient load is putting a strain on hospital resources, making it challenging to provide timely care to everyone in need. Despite these challenges, doctors and nurses are working diligently to provide care. They are employing all available resources and expertise to treat patients effectively, ensuring that each individual receives the best possible medical attention. Health officials are closely tracking the situation to assess the virus's impact. They are analyzing data from hospitals and research institutions to understand the spread and severity of the virus, which will help in formulating effective response strategies. The Chinese government is providing regular updates and guidance to the public. Through press conferences and official announcements, they are keeping citizens informed about the latest developments and measures being taken to control the outbreak. They are emphasizing the importance of prevention measures to slow the spread of the virus. Public health campaigns are highlighting the need for wearing masks, practicing good hand hygiene, and maintaining social distancing to protect oneself and others from infection. Despite the recent surge, widespread lockdowns are unlikely. Health experts believe that current prevention measures are sufficient. Instead of lockdowns, the focus is on raising awareness and promoting preventative measures. These measures include frequent hand washing, wearing masks in crowded places, and staying home when sick. Vaccination against other respiratory viruses like influenza can also help. The Chinese government is encouraging people to take these precautions seriously. They are also urging people to stay informed about the latest developments. HMPV spreads through respiratory droplets. These droplets are released when an infected person coughs or sneezes. You can get infected by inhaling these droplets or by touching contaminated surfaces and then touching your face. The virus can survive on surfaces for several hours. This makes it important to regularly disinfect frequently touched surfaces. These can include doorknobs, countertops, and toys. Section 5. Protecting yourself and others. Simple steps for prevention. In this section, we will discuss practical and effective measures you can take to safeguard your health and the health of those around you. There are several things you can do to protect yourself and others from HMPV. These steps are simple yet powerful in reducing the spread of the virus and ensuring everyone's safety. Wash your hands frequently with soap and water for at least 20 seconds. This helps to remove any germs that may be on your hands, reducing the risk of infection. Use hand sanitizer if soap and water aren't available. Hand sanitizers with at least 60% alcohol can effectively kill most germs and viruses. Avoid close contact with people who are sick. This means keeping a safe distance from anyone showing symptoms of illness, such as coughing or sneezing. Cover your mouth and nose when you cough or sneeze. Use a tissue or your elbow to prevent the spread of droplets that may contain the virus. Clean and disinfect frequently touched surfaces. This includes doorknobs, light switches, and your phone, as these surfaces can harbor germs. If you are sick, stay home to avoid spreading the virus to others. Resting at home helps you recover faster and prevents others from getting sick. Get plenty of rest and drink fluids to support your body's recovery. Staying hydrated and well-rested boosts your immune system, helping you fight off the virus more effectively. Section 6. Managing HMPV treatment and home care. There is no specific treatment for HMPV. Most people recover on their own with rest and home care. Treatment focuses on relieving symptoms. Over-the-counter pain relievers and fever reducers can help. Drinking plenty of fluids is crucial to prevent dehydration. A cool mist humidifier can help ease congestion. If you are concerned about your symptoms or your child's symptoms, consult a healthcare professional. They can assess the situation and provide appropriate guidance. Section 7. Importance of calm and preparedness, avoiding panic. While the rise in HMPV cases is concerning, it's important to remain calm. Panicking can lead to misinformation and unnecessary fear. Instead, focus on staying informed and taking preventative measures. Remember, HMPV is a common respiratory virus. Most people experience mild symptoms and recover fully. By following preventative measures and staying informed, we can navigate this surge effectively. Trust in the healthcare system and rely on credible sources of information. This will help you make informed decisions for yourself and your loved ones. Section 8. Conclusion: staying informed, staying healthy. The recent surge in HMPV cases in China is a reminder of the importance of respiratory virus prevention. While the situation is being closely monitored, it's crucial to remain calm and focus on what we can control. By understanding how HMPV spreads, practicing good hygiene and staying informed, we can protect ourselves and our communities. Remember, staying informed and taking preventative measures are our best defenses against respiratory viruses like HMPV.